Part A. Extract 1. Questions 1 to 12. You hear a urologist talking to a parent called Mihiraa about the 5-year-old daughter. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. And this must be Mia. Please make yourselves comfortable. I'm Dr. Rocker, the urologist handling Mia's case. Now, Mihiraa, your GP referred Mia here suspecting a UTI. Can you tell me more about what brings you here today?
Thank you, Dr. Rocker. Yes, Mia's been experiencing some discomfort when she uses the bathroom. Frequent urination, and it seems to sting a bit at times.
I see. How long have these symptoms been present?
About a week now. She started complaining of a burning sensation when she urinates, and she needs to go quite frequently, even at night. Sometimes, the urine seems cloudy and has a strong odor.
Have you noticed any other symptoms, like fever, blood in the urine, or abdominal pain?
No, thankfully not. She seems a bit tired and cranky too, which isn't like her usual self.
Okay, that's helpful. Have you tried any remedies at home to ease the symptoms?
We've been encouraging her to drink plenty of fluids, cranberry juice specifically, and I've applied a warm compress to her abdomen a few times.
Good. Those are both positive steps. Now, has Mia had any previous UTIs or other urinary tract problems?
No, fortunately, she's been generally healthy. She did have a mild case of gastroenteritis last month, but recovered quickly.
Excellent. Are there any allergies or medications Mia is currently on?
No allergies, and she relies solely on a daily children's omega-3 supplement for her nutritional needs.
Perfect. Now, to get a clearer picture, could you tell me a bit about Mia's lifestyle? Does she attend daycare or have frequent diaper changes?
She's in kindergarten, so yes, she's around other children quite a bit. Diapers, of course, aren't an issue anymore.
Right. Given the symptoms and Mia's age, a UTI is certainly a possibility. I'll need to perform a urine culture test to confirm the diagnosis and identify the specific bacteria involved.
Of course. What does that involve?
It's a simple procedure where Mia provides a urine sample. We can collect it here in the office, or you can take a sterile container home.
I understand. Is there anything else we can do in the meantime to help Mia feel better?
Absolutely. Continue with the increased fluids and warm compresses. You can also try giving her over-the-counter pain relievers like ibuprofen if she's uncomfortable. However, it's important to consult the dosage instructions carefully and avoid exceeding recommended amounts.
Of course. What about after the test results come back?
Once we have the results, I can prescribe targeted antibiotics to clear the infection. We'll also discuss any other necessary steps depending on the specific bacteria and Mia's individual case.
Thank you, Dr. Rocker. I feel much better informed and relieved now.
You're welcome, Mihiraa. Don't hesitate to ask if you have any further questions. We'll be in touch soon regarding the test results and next steps, including the possibility of a biopsy to further investigate any abnormalities.
Extract 2. Questions 13 to 24. You hear a family physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in today?
Oh, doctor, I was gardening yesterday, and unfortunately, I stepped on a rusty nail. And it did bleed quite a bit.
I understand. Can you tell me more about the accident?
Yes, the nail punctures my skin deeply. I pulled it out immediately, but there was some blood.
I see. Did you clean the wound thoroughly?
Yes, of course. I washed it with soap and water, then applied some antiseptic cream.
Any pain or swelling around the wound?
While there is a slight stinging sensation, there doesn't appear to be any accompanying redness or swelling.
And have you noticed any other symptoms since the accident?
It's throbbing quite a bit. I'm also feeling a bit under the weather, with some fatigue and mild muscle aches.
Have you tried any home remedies for the wound?
Just the usual, doctor. Some turmeric paste and a bandage to keep it clean.
That's good. Now, Mihiraa, when was your last tetanus vaccination?
I honestly can't remember. It's been a while, definitely.
It's okay, Mihiraa. Let me explain. Tetanus is a potentially fatal bacterial infection that can enter the body through open wounds, like the one you sustained. The bacteria produce a toxin that affects the nervous system, causing painful muscle spasms, lockjaw, and so on.
What? That sounds terrifying.
It is. Early symptoms of tetanus can include stiffness in the jaw, difficulty swallowing, and muscle rigidity. If left untreated, it can progress to respiratory failure and death.
Oh dear, this sounds serious.
Given the nature of your injury and the uncertainty of your vaccination history, I strongly recommend a tetanus shot. It's a safe and effective way to prevent this potentially life-threatening infection.
But wouldn't the antiseptic cream I used be enough?
While cleaning the wound is important, it doesn't guarantee complete protection against tetanus spores, which can remain dormant in the soil for years. The vaccine, on the other hand, stimulates your immune system to produce antibodies that can effectively neutralize the toxin even if you come into contact with the bacteria.
Doctor, you've made a compelling case. Let's go ahead with the vaccine. As you wisely pointed out, it's better to err on the side of caution. Thank you for your guidance.
Excellent decision, Mihiraa. This will ensure your safety and peace of mind.
Thank you, doctor. I feel much more relieved now.
That is the end of Part A. Now, look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a pharmacist explaining an antiseptic bacterial cream to a patient called Mihiraa. Now read the question.
Hello, Mihiraa. Let's discuss this antiseptic cream. It's potent, but it's not suitable for all skin types. Any allergies or sensitivity could lead to irritation.
Got it. I don't have any allergies, but my skin can be sensitive.
Good to know. Also, while it's effective against many bacteria, it's not a universal solution. Think broad spectrum, not all-inclusive. Remember to clean the affected area thoroughly before applying. Debris can interfere with its effectiveness.
Understood. Anything else I should know?
Yes, avoid tightly bandaging the area. Air circulation helps the healing process.
Thanks for the tips. I'll be careful.
Now look at question 26. You hear a nurse talking to a parent called Mihiraa about a urine sample collection. Now read the question.
Hello, Mihiraa. Let's go over the urine sample collection process for your child. It's crucial to get this right.
Sure, what do I need to know?
Firstly, ensure your child is well hydrated, but not excessively so, to avoid diluted results. Then, the sample must be collected midstream to ensure accuracy.
Got it. What about the container?
Yes. It must be sterile. No touching the inside, please. Any contamination could skew the results.
Understood. And when should I collect it?
During a specific time frame. Timing is crucial to maintain accuracy. Once collected, bring it to the lab promptly for analysis.
Thanks for the guidance. I'll make sure to follow all the steps carefully.
Now look at question 27. You hear a lecture to a new nurse about collecting patient details. Explain Mihiraa as a sample patient. Now read the question.
Let's discuss the importance of gathering accurate patient details, using Mihiraa as an example. When documenting Mihiraa's information, be mindful of her complex medical history, including allergies and prior surgeries. Pay attention to cultural considerations. Mihiraa may have dietary restrictions or prefer certain treatments based on her beliefs. Additionally, ensure confidentiality. Mihiraa might have sensitive information that must be safeguarded. Lastly, verify her identity meticulously. Errors could lead to administering incorrect treatments or medications.
Now look at question 28. You hear a nurse explaining the procedures of the tetanus vaccine to a patient Mihiraa before the vaccination. Now read the question.
Good morning, Mihiraa. Before we proceed with the tetanus vaccine, let's go over a few important points.
Sure, what do I need to know?
Firstly, it's crucial to be aware of potential side effects. While rare, allergic reactions can occur. Secondly, timing is essential. Missing booster shots may compromise your immunity. Thirdly, keep an eye on the injection site. Any swelling or redness could signal adverse reactions. Also, consider your medical history. Certain conditions may warrant caution. Lastly, post-vaccination, monitor for any unusual symptoms, such as fever or dizziness.
Got it. I'll keep all that in mind. Thank you for explaining.
You're welcome. Let's proceed with the vaccination.
Now look at question 29. You hear a dietitian talking to a parent of a 5-year-old called Mihiraa. Now read the question.
Good afternoon, Mihiraa. Let's discuss managing UTIs for your 5-year-old.
Certainly, what should I know?
It's more than just cranberry juice. Hydration is key, but watch out for excessive sugar. It can worsen symptoms. Also, be mindful of caffeine, it can irritate the bladder. And acidic foods like citrus fruits might aggravate things. Finally, ensure a balanced diet with plenty of probiotics to support urinary tract health.
Got it. I'll keep an eye on those factors. Thanks for the advice.
You're welcome. Let's ensure your child stays healthy.
Now look at question 30. You hear a nurse talking to a patient called Mihiraa about wound care. Now read the question.
Mihiraa, proper wound care extends beyond basic cleaning. While keeping the wound clean is crucial, avoid overcleaning, as it can disrupt the natural healing process. Additionally, be cautious with topical ointments. Some may cause allergic reactions or delay healing. Monitor for signs of infection, such as increased redness or pus. Consider your dressing choices carefully. Improper dressing can trap moisture and breed bacteria. Finally, adhere to proper nutrition. Deficiencies in vitamins like C and zinc can impede wound healing.
That is the end of Part B. Now, look at Part C. Part C. Extract 1. Questions 31 to 36. You hear an interview between Dr. Mihiraa and an interviewer on preventing tetanus, why vaccination is crucial. You now have 90 seconds to read questions 31 to 36.
Good afternoon, Dr. Mihiraa. Thank you for joining us today to discuss the tetanus vaccine. Let's start with the basics. What exactly is a vaccine, and specifically, what is the tetanus vaccine?
Good afternoon. Thank you for having me. A vaccine is a biological preparation that provides active acquired immunity to a particular disease. It typically contains weakened or killed forms of the microorganism responsible for the disease, or its toxins, which stimulate the body's immune system to recognize and destroy the threat if encountered in the future. The tetanus vaccine, specifically, is designed to prevent tetanus, a serious bacterial infection caused by Clostridium tetani. This bacterium is commonly found in soil, dust, and manure and produces a toxin that affects the nervous system, leading to severe muscle spasms and potentially life-threatening complications.
That sounds quite serious. Why is it so important for individuals to receive the tetanus vaccine?
Tetanus is no laughing matter. The importance is multifaceted. The tetanus vaccine is crucial because tetanus is a highly preventable but potentially fatal disease. The toxin produced by Clostridium tetani can cause muscle stiffness and spasms, particularly in the jaw and neck muscles, which can interfere with breathing and swallowing. Without prompt treatment, tetanus can lead to respiratory failure and death. By receiving the vaccine, individuals can develop immunity against the bacterium, significantly reducing their risk of contracting the disease. It's estimated that widespread tetanus vaccination has reduced deaths by over 99% globally. That's a substantial contribution to public health.
Alright. Mihiraa, I wonder why the tetanus vaccine is advised as a preventive measure rather than a curative one.
Tetanus, once contracted, can be a medical nightmare. Tetanus is a disease that is better prevented than treated. Once symptoms of tetanus appear, the disease can be challenging to manage and often requires intensive medical care, including medications to neutralize the toxin and supportive measures to control muscle spasms and prevent complications. However, even with treatment, tetanus can be fatal in some cases. Therefore, vaccination is recommended as a preventive measure to avoid the risk of infection altogether, rather than relying on treatment after exposure. By getting vaccinated, you're essentially nipping the problem in the bud before it even arises.
Dealing with social groups that are against vaccination can be challenging. Mihiraa, how do you approach this issue, and do you have any examples of successful strategies?
There is a lot we have tried. Implementing mandatory vaccination policies, vaccination campaigns, promotional activities, educational activities, and so on. Addressing vaccine hesitancy and resistance requires a multifaceted approach that involves education, communication, and building trust. One effective strategy is to provide accurate information about the safety and efficacy of vaccines, addressing any misconceptions or concerns that individuals may have. Additionally, engaging with community leaders, healthcare providers, and other trusted sources can help dispel myths and increase confidence in vaccination. For example, in some communities, peer-to-peer outreach programs led by trusted community members have been successful in promoting vaccination uptake and countering misinformation.
Why are booster doses of the tetanus vaccine necessary, and why isn't there a lifetime preventive capability for this vaccine?
Booster doses of the tetanus vaccine are necessary because immunity to tetanus wanes over time. While the initial series of tetanus vaccinations provides robust protection, the immune response may weaken over the years, leaving individuals vulnerable to infection. Booster doses help to boost the immune system's memory of the tetanus toxin, ensuring continued protection against the disease. As for why there isn't a lifetime preventive capability, it's primarily due to the nature of the immune response and the characteristics of the tetanus toxin. The immune system's memory cells may decline in effectiveness over time, requiring additional doses to maintain immunity. Furthermore, the tetanus toxin itself is highly potent and can cause severe illness even at low doses, necessitating regular reinforcement of immunity through booster doses.
Are there any alternatives to the tetanus vaccine currently available or under development?
No safe and effective alternatives exist. Vaccination remains the most reliable and well-studied method to prevent tetanus. While the tetanus vaccine remains the primary means of preventing tetanus, there is ongoing research into alternative approaches, such as immunotherapy and novel vaccine formulations. Immunotherapy involves the administration of antibodies or immune system modulators to enhance the body's response to tetanus toxin. Additionally, researchers are exploring new vaccine technologies, such as DNA vaccines and nanoparticle-based vaccines, which may offer improved efficacy and durability of immunity compared to traditional vaccine formulations. However, it's essential to note that these alternative approaches are still in the experimental stage and require further research and development before they can be widely implemented.
Now look at Extract 2. Questions 37 to 42. You hear a urologist talking about a case study conducted on UTI at Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
Welcome, esteemed colleagues and researchers, to the Mihiraa Research Center. Today, I have the honor of delving into a topic that plagues millions globally: urinary tract infections, UTIs. As a urologist, I've witnessed firsthand the impact these infections have, and I'm eager to share insights that not only illuminate UTIs, but also spark further exploration. A UTI is essentially an invasion of unwelcome guests, bacteria, into the usually sterile sanctuary of your urinary tract. This tract encompasses the kidneys, ureters, bladder, and urethra, responsible for filtering waste products and eliminating them through urine. When bacteria, most commonly Escherichia coli, E. coli, breach the defenses and establish themselves, the result is a UTI. The global impact of UTIs is staggering. According to the Mihiraa Research Center, it is estimated that nearly 150 million individuals experience UTIs annually, with women disproportionately affected. This translates to a significant economic burden, with healthcare costs associated with UTIs reaching billions of dollars worldwide. The ripple effect extends beyond finances, impacting individual well-being, family as well as personal space and productivity. As per findings from the Mihiraa Research Center, while women are statistically more susceptible to UTIs due to their shorter urethra, it is crucial to remember that UTIs are not exclusively female concerns. Men, especially those with anatomical abnormalities or undergoing urinary procedures, are also vulnerable. Additionally, infants, pregnant women, and individuals with compromised immune systems face an increased risk. However, attributing UTIs solely to gender is an oversimplification. Several biological and behavioral factors contribute to susceptibility, including hormonal changes, sexual activity, hygiene practices, and even bladder habits. Recognizing this intricate interplay is essential for effective prevention and management. The realm of UTIs extends beyond the purely biological. Emerging research carried out at the Mihiraa Research Center suggests a fascinating connection between habitual consciousness and UTI risk. Studies have shown that individuals with higher levels of stress, anxiety, and negative emotions tend to be more prone to UTIs. This link potentially stems from the impact of these emotions on the immune system and bladder function. Therefore, incorporating stress management techniques like mindfulness and relaxation exercises into UTI prevention strategies might hold promise. Cultivating a mindful awareness of your body's signals and bladder habits can empower you to take proactive measures against UTIs. While the influence of genetics on UTI susceptibility is being actively explored, the picture remains hazy. Some studies here at the Mihiraa Research Center that have identified potential genetic variations associated with increased UTI risk, but the evidence is inconclusive. It is likely that a complex interplay of genetic predisposition and environmental factors determines individual susceptibility. Therefore, while genetic testing for UTI risk might be a future possibility, it is currently not recommended. Focusing on modifiable lifestyle factors and seeking timely medical attention remain the cornerstones of UTI prevention and management. Based on the research carried out at the Mihiraa Research Center, ignoring a UTI is akin to inviting a persistent tenant who wreaks havoc on your urinary tract. Left untreated, UTIs can escalate into serious complications, including kidney infections, sepsis, and even permanent kidney damage. Early diagnosis and prompt treatment are crucial to prevent such detrimental consequences. Treatment options for UTIs vary depending on the severity and type of infection. Antibiotics are the mainstay of treatment, with the specific choice tailored to the identified bacteria. In some cases, additional medications or procedures might be necessary. Remember, self-medication for UTIs is strongly discouraged, as it can lead to antibiotic resistance and worsen the infection. To illustrate the multifaceted nature of UTIs, let us delve into a captivating case study done here at the Mihiraa Research Center. Sylvia, a 52-year-old diabetic woman, presents with recurrent UTIs. Upon investigation, we discover a combination of factors contributing to her predicament. Firstly, Sylvia has a minor congenital abnormality in her urinary tract, predisposing her to bacterial colonization. Secondly, hormonal changes associated with menopause can increase susceptibility to UTIs. Additionally, Sylvia's stressful lifestyle, characterized by demanding work and family responsibilities, may be impacting her immune system, making her more prone to infections. Furthermore, inadequate hydration exacerbates the situation by creating an environment conducive to bacterial growth in the urinary tract. Unraveling this complex web of factors is crucial for crafting an effective treatment plan. In Sylvia's case, a comprehensive approach is warranted, including antibiotic therapy to target the infection, dietary modifications to increase hydration, stress management techniques to bolster her immune system, and regular follow-up appointments with a urologist to monitor progress and prevent future recurrences. This holistic approach aims to break the cycle of recurrent UTIs and ensure Sylvia's long-term well-being.
That is the end of the listening test. Note check the answers.